Most people think shrinking, stooping, and fragile bones are just a part of getting older. But here's a story that flips that on its head. I have an 80-year-old patient who has kept her height, no shrinking, because of a rhythmic hormone replacement method called the Wiley Protocol. Meanwhile, new research shows that 1 in 5 men over 50 will experience an osteoporotic fracture, yet almost none of them are screened. And men are actually more likely than women to die from fracture complications. Today we're talking hormones, bone loss, and what you can do, whether you're a woman, a man, or someone trying to age without becoming fragile. Hi everyone, I'm Dr. Fred Bloem, Integrative and Regenerative Physician here in Maryland. If you're into longevity, hormones, regenerative therapies, and practical medicine that actually makes you stronger, not weaker, this channel is for you. Hit like, subscribe, and join my newsletter so you don't miss future videos. Let's dig in. We've been taught that osteoporosis is a menopause problem. The truth is far different. According to new international guidelines, 1 in 5 men over age 50 will suffer an osteoporotic fracture. Men are more likely to die after a fracture, 37.5% 1-year mortality versus 28.2% in women. Men are rarely screened despite equal fracture risk, and hospitals spend nearly 3 times more per fracture in men because recovery is slower and complications are more common. We're dealing with a hidden epidemic of brittle bones in men made worse by chronic illness, lack of screening, and hormonal decline. Men don't notice bone loss early because they tend to lose trabecular thickness, not structure. You can feel fine right up until something breaks. So this affects everyone. Women, yes, but men, even more than most realize. According to the article, bone loss happens because we sit too much, we eat processed foods, we stop strength training, we lose hormones, estrogen in women, testosterone in men. Medications like steroids, anticonvulsants, and hormone blocking treatments accelerate bone loss. Chronic inflammation, chronic illness, and nutrient deficiencies erode bone strength over time. Your bones are not cement pillars. They're living tissue that responds to stress, movement, sunlight, and hormones. Every walk, lift, jump, or even staircase sends signals to your bones saying, stay strong, rebuild. And every day of inactivity sends the opposite message. Now let's talk about women and one of the most powerful tools they have. The Wiley Protocol is a rhythmic bioidentical hormone replacement system designed to mimic the natural hormonal patterns of a healthy 25-year-old woman. What separates it from conventional hormone replacement therapy? Estrogen rises and falls in a natural rhythm. Progesterone is pulsed during the luteal phase. Doses follow physiological curves, not flat levels. The body recognizes the rhythm. It's what it evolved to expect. This matters deeply for bone health. Estrogen maintains bone density, bone turnover, and mineralization. When estrogen disappears, bone loss isn't slow, it accelerates. One of my longtime patients started the Wiley Protocol years ago. Even at age 80, her height has remained the same. Her friends, they've lost inches. She hasn't. Her posture is upright. Her spine is strong. Her bone structure is aging gracefully. The Wiley Protocol didn't just help her symptoms. It preserved her architecture. Hormones are powerful and when used correctly, safe. The article highlights something crucial. Testosterone is one of the most important hormones for bone remodeling. Men convert testosterone into estradiol through aromatase. Estradiol slows bone breakdown. Without testosterone, that pathway collapses. Of course, we need to carefully monitor both testosterone and estradiol levels so they remain within physiological limits. Low testosterone leads to rapid bone loss, loss of muscle, abdominal fat, higher fracture risk, slower healing, balance problems, weakness, and frailty. And yet, men are almost never screened. Many men over 50 are walking around with low testosterone, low estradiol, high sex hormone binding globulin, low vitamin D, poor nutrient status, and a sedentary lifestyle. That combination quietly hollows out their bones. Testosterone therapy, when properly monitored, can dramatically improve bone density and protect men from the catastrophic fractures the article warns about. Here's what the article recommends. These are things I already incorporate in my practice. Number 1. Movement and strength training. Weight bearing and resistance training are non-negotiable. Even walking daily strengthens bones. 2 special tools mentioned are blood flow restriction training, BFR, and whole body vibration therapy. Both stimulate bone growth without heavy strain. Number 2, bone supportive nutrition. Bones are 50% minerals, 50% collagen. So calcium is only half of the equation. Needed nutrients: vitamin D, sunlight and supplements, vitamin K2, magnesium, collagen, high quality protein, and yes, creatine. Creatine energizes osteoblasts and has direct bone benefits. Number 3, avoid the big bone killers. The article strongly warns against soft drinks. Phosphoric acid leaches calcium. Smoking, excess alcohol, processed seed oils, inactivity, chronic inflammation. Each of these accelerates bone breakdown. DEXA scans are helpful, but imperfect and involve radiation. The article recommends REM scanning, which is ultrasound based, as a safer, more accurate alternative for monitoring real bone structure, not just density. REMS is radiofrequency echographic multispectrometry. The article is very clear on this. Biphosphonates and denosumab freeze bone turnover, which can lead to microcracks, brittleness, and weaker bones long term. They stop bone breakdown, but also stop bone rebuilding. I tell my patients, we want your bones alive, not frozen. Real bone strength comes from hormone balance, movement, nutrients, sunlight, and treating root causes of inflammation or illness, not shutting your bone cells off like a circuit breaker. Here's how I help patients rebuild bones safely and naturally. Women, rhythmic bioidentical hormones, the Wiley Protocol, weight bearing and resistance exercise, collagen, D3, K2, magnesium, creatine, sunlight, gut healing for mineral absorption, removal of inflammatory triggers, better bone imaging when needed. Men, testosterone evaluation and replacement when appropriate, monitoring of estradiol, same nutrient and exercise principles, eliminating medications or habits that erode bone, fixing chronic inflammation. When you restore physiology, not fight it, you rebuild. If you're worried about aging, strength, posture, shrinking, or bone density, this is not something to ignore. Whether you're a woman who wants to stay strong through menopause or a man who had no idea bone loss affects you just as much, hormone balance and lifestyle changes can completely rewrite your future. If this resonates with you, you can schedule a consultation with me. I can evaluate your hormones, create a personalized plan for bone strength, and help you rebuild from the inside out. Have you or someone you love noticed height loss or posture changes? Did you know men had such a high fracture risk? Would you like a separate video just on the Wiley Protocol? Men, should I create a full video on testosterone, bone health, and longevity? Post your thoughts below. I read every comment.